Modern cataract surgery claims to be the one which provides earliest visual rehabilitation. It's a walk-in and walk-out procedure. No bandage, no work clothes, and a person can resume normal activity from the very day of surgery. Is it true? In reality, we see that the patient has to put multiple drops into his eyes for several times a day for at least a month. Can we call it a rehabilitation? For eye drop, there are other issues also to be considered. Compliance, cornea, callbacks, and costs, the 4 C's. Let us go for the compliance. Many of the persons, because of the illiteracy or lack of dexterity, even do not know how to put an eye drop into his eyes. This person, he has full dexterity, but his aim is not good. He is putting the eye drop into the lids, and somebody whom other people has to put eye drop also do not fare well. Most of the people do not maintain hygiene. Here you can see she is wiping the eye with a dirty cloth after installation of the eye drop. And the cornea. It is said that 20% of the post-cataract surgery patients suffer from dry eye disease. Look at these corneas, full dry. It is a big insult to the ocular surface if we subject this patient to multiple doses of eye drop. And with eye drop, you are subjected to multiple callbacks from the patient, which eye drops to be put into which eye, how many drops, etc. And of course the cost of medicine. All these things, the problem of putting eye drop following surgery can be solved by a very simple solution. This is what we call dropless cataract surgery. It's a new star in the horizon of management of cataract surgery. It's a new concept where steroid and antibiotics are introduced transgenularly into the vitreous cavity at the end of the IOL implantation in phacosurgery. This eliminates the need for installation of eye drop postoperatively. This is a very simple procedure. What we do is we take 0.1 cc of moxifloxacin and 0.1 cc of triamcinolone acetonide into a tuberculin syringe. Then we attach a 27 gauge band cannula. Then methyl cellulose is injected into the space between the iris and the anterior capsule initially. Then the combination of moxifloxacin and triamcinolone is injected transcellularly into the vitreous. So here they are, triamcinolone. What we take is Vigamox, which we usually use intracamerally. This is the insulin syringe, and this is the 27 gauge band cannula. So here is it. After the surgery is over, we are putting the lens into the bag. Once it is accomplished, we do irrigation and aspiration. Then again we put more viscoelastics into the sulcus so that a space is being created. Here the 27 gauge band cannula, we go beyond the capsular equatorial region of the capsular bag. This is a blind procedure. We find the gap in the zonium and inject slowly. So this is one case. Let us see after the injection, we take out the methyl cellulose as usually. We can also shake it like we shake a bottle before use. Another case, injecting, finding out the transcellular space and injecting slowly the mixture of triamcinolone acetonide and moxifloxacin. Another case, finding the transgenular space. This is a blind procedure, has a small learning curve. We did a study at our hospital and with 50 patients with dropless cataract surgery. It was a prospective study. The aim of the study is to find the efficacy, intra and postoperative complications of dropless cataract surgery in a tertiary eye care hospital. We measured the visual acuity, did slit lamp examination and IOP on the first 7, 38 and 68 days. The result is that UCVA improved in all cases. 72% achieved 6/9 or better on the day 1, which improved to 95% on day 60. 10% of the patients complained of floaters on the day 1, which decreases. 6.6% complain of floaters on the day 30, and at the end of day 60, nobody complained of floaters. Overall, mean IOP was normal on all days of examinations. Of course, we had few intraoperative complications. One is leakage. As I said, it's a blind procedure. Sometimes it doesn't go into the vitreous cavity, it goes into the anterior chamber only. Another is the bleeding. This probably sometimes the needle hits the ciliary body. Again, this has occurred in 2 or 3 patients, and it is not difficult to control it. And iris prolapse is a commoner thing because there is rise of intraocular pressure following the injection. The iris sometimes come out. This is also not difficult. The most important thing is the very excellent postoperative result on the day 1. There are no cells and the eye is totally white. What we find in normal cataract, there is some amount of congestion, but it is not here at all. This is one of our patients. We took an interview. So, did you have any complaint? He said that except that on first few days there were some floaters, otherwise it is a very uneventful period. She was quite happy with the procedure. This is a very fantastic procedure. This procedure can establish in the arena of cataract surgery. This will be a boon to the working class people for whom installing eye drops in between manual work really a cumbersome procedure. Thank you.